Hei kaikille, mä oon Katja Puolakka ja mä toimin Barral Institute Finlandin maajohtajana. Tänään mulla on haastateltavana Alison Harvey Skotlannista. Ja Alison opettaa paljon Barral Instituutin kursseja, mutta annetaan Alisonin hieman itse kertoa. Hi Alison, thank you for joining me today for the interview.
Yeah, you're welcome.
So, could you tell a little bit about your background first and introduce yourself?
So I'm originally from Scotland. I decided to train initially as a chiropractor, following being ill during my teens and receiving a lot of help from a chiropractor locally to me. I went to chiropractic college after I finished high school, studied there for 5 years, and while I was there, I also started studying applied kinesiology, which is a muscle testing system. Through applied kinesiology, it introduced the concepts of cranial work and also, in a way, the concepts of visceral work. So I wanted to know more about these. And initially, I studied with the Upledgerin Instituutti in craniosacral therapy, and I became an Upledger craniosacral instructor. And I've instructed in Finland a few times in the past also, teaching cranial 1 and 2. With the courses from Barral Instituutti and Upledger being run together, especially in the US at that time, when I was traveling in the US doing classes, I discovered visceral manipulation and started training in visceral manipulation in 2002. At that time, there was really nothing much happening in this country, so I ended up flying to America, usually 5 times a year, to do classes in America. And by 2008, I started complaining to the Barral Instituutti about the lack of classes in the UK, and they asked me when I was going to start organising them. So not something I'd planned to do, but in 2009, we ran our first class in the UK, and in 2011, I became a Barral Instituutti Visceral 1 instructor and have been instructing ever since. So it's very much my passion now as well, both running the classes and teaching the classes, and of course still treating patients.
So, what sparked the passion for you with the visual manipulation?
Yeah, so initially, as I say, I bumped into the classes because they were run together with the cranial classes. Somebody came and did an introduction. One of the visceral teachers in the US did an introduction to visceral manipulation when I was studying cranial over there, or when I was assisting actually a cranial class over there. But what I realized was that through my training, when I trained as a chiropractor, it looked very much at the joints, the bones, but it really ignored both the cranium and also the visceral cavities. So with the craniosacral therapy, it gave me a lot more information about the cranium, but I was still missing the details of what happened within all the internal organs and within the cavities of the body. It was like this part of anatomy missing. So when I started studying the visceral manipulation, it really filled in that missing part for me. And I was fascinated at how much you could feel within the visceral cavities. And then I also, of course, through receiving treatment, as you do in the classes, started experiencing changes in my own body and finding that some of my functions, digestion, so on, were improving. And so I became keen to learn more and more.
And what type of clients do you mainly treat?
Well, I've run my own clinic in the town where I live now in Ayr in southwest Scotland for 21 years, and it's very much a mixed base. It started off when I first moved here. I've been doing a lot of paediatric work. I've been working with fertility issues to some extent, and that was increased further with the visceral work. I'd worked in a clinic for disabled children as well before I moved here. And so my focus initially, I'd intended to be very much pediatrics. But the thing with pediatrics is they come with parents, they come with grandparents, they grow up and they stop being pediatrics anymore. One of my patients that I was actually treating for fertility, then of course the baby came along and I was at the birth, and then treated the baby. She's now at university and comes back to see me in her holidays. So my practice has really developed back into a very mixed practice and seeing all generations and all stages of people and all different issues. So I find my scope is very wide because of having both the structural work, the visceral work, and then the kinesiology as well, which allows me to get more into nutritional stuff. So yeah, I have a very, very mixed practice, and actually I really enjoy that now. I love seeing people from all ages and stages of life at the moment, I mean, I've been at the birth of some of my patients, so I've seen them from the very beginning. And my oldest patient to date has been 102. So it's definitely the full range.
Definitely sounds like it. Yeah. You teach several classes for the Barral Institute. Which ones? And do you have one that you like the most, or which is dear to you?
Ooh, there's difficult questions. So I teach visceral 1 to 5, listening techniques, and the 2 vascular classes. So I kind of like all of them, but for different reasons. So visceral 1, I love because you get so many aha moments in the class where people suddenly can feel something they never imagined they could, and I see the lights come on and they get excited about it. So that's always really nice. Visceral 2 is lovely because people are coming back. They already know some things, but maybe haven't put everything together. And usually by the end of Visceral 2, people are really starting to get the pieces, put them together, understand how everything works. Visceral 3 is the pelvis, which I've always enjoyed working with the pelvic details. I do a lot of work, as I say, and have done a lot of work with women's health, with fertility. So I always think they're really useful and important details to add to people's skill set. Visceral 4, the thorax. It's a very involved class. There's a lot of information in it, working with all the aspects of the thorax, getting into the neck, getting into the breathing, getting into the circulation system. So that's a really nice doorway to lots of other pieces for people, and often a missing link of parts within the body for them. Visceral 5 is opening up a whole new direction, going into new evaluation technique, manual thermal, but also into the visceral emotional. So that's always another aha moment, an exciting time for people when they realize that they can actually look at not only the physical aspect of what's going on with someone, but perhaps help them also deal with the emotional component of it. So that's always lovely. Listening was probably my favorite class as a student because it was the point when I learned to really trust my hands in terms of palpation. So being able to share that with so many other people now is really wonderful. And it's a class that's not giving so much new skills, but helping people perfect what they've already got. And so there's more space and there's more time in it. It's more experiential, so people love that. And the vascular work, I also really enjoy. It's the newest one of all the pieces I'm teaching. So I'm still working with that and getting into that a little bit more myself. But what I love with the vascular is that you can take the pulse. You can change something somewhere away from where you're palpating the pulse that perhaps isn't as even or as smooth as it could be. And within seconds, you can feel the change in that pulse. So I love the feedback that you get in vascular, and how in a way is extremely precise and something that's very measurable in terms of change, whereas some of the other classes, it's more of a palpatory sense of has something released or softened or something changed. So it's like this instant, very measurable feedback, which I think a lot of students really enjoy. And looking at another system and working with different tissues. So yeah, I love it all. Is the answer, but all for different reasons.
Yeah. VM1 and VM2, in both in those working in the abdomen. Can you tell a little bit about why those are why there's 2 classes there, and also should people take both of them? Think that as a one class, or what's your thoughts on that?
So many years ago, when I first started doing visceral, there was one class, and it was majorly overloaded. All the time you were pushing to get through all the information, and there wasn't actually the detail there is about any organ now in between visceral 1 and 2. So what happened was the Barral Institute split them into 2 classes, so that there was more time, but also so there could be more detail in each class. So visceral 1 is really important because it's giving you the key concepts, it's giving you the key evaluation techniques, and it's giving you, along with giving you a lot of organs to work with. So it works with the abdominal digestive system, so the liver, stomach, the duodenum, small intestine, large intestine, gallbladder. So really, by the end of visceral 1, you have the capacity to work with digestive problems quite well, but not so much with other things. Visceral 2 is going into some of the deeper organs. So it goes into the kidneys, the pancreas, the spleen. It looks at the peritoneum, which is the wrapping all the way around all the abdominal organs. And then the omentums, which are like the bridges between organs. So we have a lesser omentum between our liver and stomach, and a greater omentum between the stomach and the transverse colon. So it helps refine and build on the techniques that are learned in Visceral 1, and we do some special parts or additional information. So, for example, we work with the hiatus area of the stomach, looking at things like reflux and hiatus hernias, which are very common problems in Visceral 2. But these perhaps require a little bit more refinement of palpation skills, and hence they're kept for Visceral 2. And they're a bit more detailed than what we're teaching in Visceral 1 with the stomach. And then, as I said, adding in the other organs, so things like the kidneys, the spleen, the pancreas, that are either more delicate or more difficult to palpate. So the kidneys are quite a long way back in the body, and they're not as easy to palpate as, for example, the stomach or the liver would be. So again, waiting for a little bit of experience already, feeling some organs and having the awareness of what's going on with the viscera before we're teaching those components. And we also add some additional evaluation and treatment techniques in Visceral 2 as well. So I can't say that one's more important than the other. It's important to do them in the right order, because if you don't have the basic knowledge from Visceral 1, it's very difficult to grasp what's going on in Visceral 2. In Visceral 2, I find generally people have come back from Visceral 1 having practiced with it and found they have some questions, or they have some lack of flow in how they're working. And in Visceral 2, we are able to give people that extra information and that flow and that confidence of what's going on, so that they can then really follow through and start to understand and work with the visceral system better.
So it sounds like that the VM2, that adds on and like fills the missing pieces that some might have from the VM1.
100%.
And who do you recommend the classes? Who should take the visual manipulation?
You mean starting from the very beginning for training?
Yes, from the beginning.
Anybody who has got anatomy knowledge and hands-on skills. The number of people that I have had on training from all different backgrounds who have found that this is really enhanced and added to their practice. And that goes from everything from osteopaths, physiotherapists, through to massage therapists, nurses, doctors, all different backgrounds, acupuncturists we've had come on the courses, and there's not a single one who's turned around and said, oh, I already knew this, or it hasn't added to my practice in any way. So any background really. And what I found for me, and I always say this in classes, the one piece that you can guarantee I will do on every single person is the visceral evaluation techniques. So I, when I'm working, have a toolbox of 4 different core therapies I use: chiropractic, visceral, cranial, and kinesiology. And I will cherry pick from them depending on what problem comes in, and use different skills from different ones of those therapies. But the one thing I start with on every single patient is the evaluation, doing the general listening, the local listening, going on and doing mobility and motility testing. And that guides me where to work, because the visceral evaluation techniques are global. They incorporate everything in the body. So they don't say, oh, I can't show you a spinal problem because you're not doing chiropractic today. So they will show me, if it needs to be a chiropractic piece I'm doing, they will show me a spinal problem, if that's what's the biggest thing for that person. So it's given me a lot more clarity in my practice as to where to work. And that's the gift that I see it gives to so many different people, that they have the evaluation skills, and then they can use them to help guide their whole treatment plan, whatever treatment they're actually using when they get there.
Thank you. Anything else that you want to say or share before we finish the interview?
Well, I suppose the one thing I can think of is that I started running the Barral Instituutti here in the UK 15 years ago, and my intention was that we would run 2 classes per year. And what I have found over that time is the people learning it have been demanding more and more and more classes, because they want to know more and more, because once they've learned something, they realize, I also would like this piece, and I'd like that piece, I'd like the next piece. And so here in the UK, the classes have grown to, well, before COVID, they were up to 18 classes per year. And that was us limiting them, because people perhaps wanted even more still. So I think through that, and also looking at my clinic, which is extremely busy, and it's only word of mouth. Both of them are really testament to the value of this work, and it's something that I've seen so many practitioners find has really helped enhance and build their practice and increase their number of recommendations, just by having this skill set in their as one of their options. And so I would absolutely encourage people to do it, because of course we know the courses cost some money and they take some time, but the payback from it can be just so great. And I think it's a lovely thing to be able to share with the world. And more than that, every practitioner we train has the option to go ahead and treat so many more people and help so many more people in the world with their health. And nobody else is really doing this work in terms of the visceral work to help people. The medics will go in and they'll do some surgery, or they'll look and see what's going on inside the organs, but they never look at how are the organs moving between one another. What's happening that's causing this restriction pattern to develop all the time? And that's the work that we're doing. So I think it's highly valuable and essential work for so many people. And that's what I suppose drives me, both in teaching classes and organizing classes, is the will to have this work reach so many more patients around the world. And so I can only encourage people to come join the classes, give it a try, and see how it affects their practice and helps their future.
Thank you, Alison. Thank you so much for sharing your knowledge and also your passion. And it will be a pleasure to work again with you. And I know that the students will be in good hands. You were actually my CS2 instructor a few years ago. And knowing how I learned from you, that's and how some teachings and the practical things that we did are still with me. So I know that we will be in good hands. It will be a pleasure to learn from you. Thank you.
Yeah, it'll be a pleasure to work with you again as well.